So oftentimes, vision therapy and binocular vision doctors are known to prescribe prism glasses. And prisms are prescribed for a number of purposes. The most common purpose is for fusion of both eyes together when there is double vision. Oftentimes, when I'm prescribing prism for this purpose, they're called compensatory prisms versus therapeutic prisms. And I prescribe them typically when someone is having double vision after a concussion or a stroke or other form of acquired brain injury. So here we have prisms. This is a trial frame prism. This is a power of 1. And you can see it's not that thick. If I were to prescribe this prism, in each glasses, it would not change the looks of the glasses at all. And as we get a little thicker, which is a power of 6, this is a power of 10. And you add this to the prescription, it just gets thicker. This is a power of 20, and this is the type of prisms that we use in therapy. This is what's called a yoked prism. It's where the base is facing the same direction. Whenever we have prisms facing the same direction, yes, it moves the image, but it also rotates the image along an axis. There's a lot of therapeutic value, especially when it comes to posture and gait. This is the prism bar. And so we go 1 all the way to 45. And we can see how that just starts to move the image along, but I'll use this prism bar to determine what prism power would be appropriate for the patient, or I could use it to neutralize an eye turn. The problem is when we get to really thick prisms and we get a patient who needs power of greater than 10, particularly when we get to 20, 30, and 40 power prisms, we get a lot of distortion and you get rainbow effects. So commonly prescribed prism from 3M. This is typically the brand that you will see. It's been around a long time. This is a power 25 prism diopters. And we could see the difference in the thickness of a power of 25. You see how thick this 25 prism diopter is, and you try to put that on a lens, it's going to be quite distorted. But we have a Fresnel prism, which is a stick-on prism that goes right on glasses, and you get the image effect and you put it up close. You don't get a lot of distortion, but you do get some. It's just not convenient to put this in a pair of glasses. Makes them really thick, really heavy. So when we do a Fresnel prism, we do a stick-on prism, that is very helpful. It helps with the weight, and it helps remove a lot of the distortions. Last year when I went to the OVDRA conference, they had a new supplier of prisms by Optego. And when I looked at Optego and I looked through their filter, they gave me a really good sample, and I was won over by these prisms. I'm very grateful for Optego for making these prisms a clearer version of the old-fashioned 3M that I've known since before I graduated optometry school. Again, this has been around a long time. I am glad that we have an updated version and an innovative version where things are so much more clear. I have personally used these on quite a few patients now. Patients still do not like wearing these, but they would rather wear these and be double visioned. And if only they know what a pain this was prior to the invention of this. It is a lot clearer and it is a big deal. So if you know someone who has had a concussion or stroke and has had double vision, that is a recommendation, which is to find an optometrist or eye care professional who can provide the Optego brand of prism.